Good evening.
Good evening, Tim.
This is our May 4th meeting of the Medical Advisory Panel. And I'm thankful for all members who are available. This evening, we have one agenda item. But I want to pause and see if there are other suggestions or other agenda items that people would like to offer for our consideration. Just want to make sure that we're open and involving everyone. Our one agenda item was to address how will we handle COVID moving forward, and how will the school district respond when? And I think it's appropriate, but I will defer to the medical experts here. But when there's a spike, I think it would be. And I really appreciated some of our community members who posed the question to me. So what are you going to do when there is a spike? So I don't want to make the assumption that COVID is going to go away forever. I think it's something that we should always be vigilant about and be aware of. And that was good feedback from some of our community members. And so to that end, this panel asked that the district come up with some type of response, written response, so families would know how we will respond if something happens. I can share my screen in a second, but we did come up with some guidelines for policy 8450 that is specific to COVID-19. And I think everyone should have received those guidelines, correct? Okay. So without further ado, I'll share my screen and pull that document up. I see many of you are already in it, so that's great. Okay. So the logic with this language was to establish that if there is any further action that the school district needs to take, that it would be in adherence to mandated directives from either the CDC, the Wisconsin Department of Health Services, or our friend Laura Stevens in the city of Walatos's Health Department for public schools. And it also states that if there isn't an explicit mandate for public schools, that we would implement a plan that meets the objectives that have been cited by the Board of Education and this medical panel for the past 2 years now, which is to maximize health and safety of students and staff through mitigation strategies, and to also ensure access to in-person instruction, co-curricular activities, and community activities. We talk in this document, we talk about monitoring statistics and utilizing local, state, and federal dashboards and data sources. And then finally, that last paragraph is, I think it's my way of saying if we need to bring this group together again, I would like to reserve that right. We may be on hiatus and decide that it would be prudent for us to retire, and I would use the word retire, the medical panel after tonight. But if we do find ourselves in a situation where we need to reconvene, I think it would be prudent and healthy and wise for our community to reconvene this group. The one piece of feedback that we've received from our committee is that one of our members suggested that perhaps we should have some type of internal metric that would be triggered. And if that is triggered, then the school district would communicate to families. I think Chastity's suggestion was if you're not going to keep a dashboard, what's that tipping point, and when do we decide to communicate with families when the data is getting concerning to our nursing team internally? And I think that's an interesting and a very valuable and good suggestion that I would open it up for this group to think about. Do you have feedback? Are there areas where you would suggest we need to make suggestions or changes?
I was going to say, I think it's probably wise to maintain some sort of an internal count. Just, I agree that I don't necessarily think we need a public facing dashboard at this point. As to what those cutoffs will be, I don't, or what the trigger points would be, I don't know. But I think it would be wise, at least over the next several months, to this continues to evolve a little bit more. That way, I think it would enable you to give the community pretty specific, information, as it comes up.
I have a concern about the mandated directives portion of this. I know that there's lots of discussion about public health authority at the national, state, and local level. There's been some legislation and rulings by the Supreme Court of Wisconsin that really takes away a lot of authority to provide mandates. That's why the CDC and the state and even Laura have pivoted to guidelines. I guess my question would be, if the public health agencies offer guidelines, strong recommendations, advisories that are falling short of mandates because they don't have the authority to issue a mandate, does that mean the district is not going to follow those?
I think the goal here was to pull the district out of the culture battle of what to do with mitigation strategies. And if there is a way for the medical professionals to give us a directive, then that would be the preferred path to go, versus us reinserting ourselves in the middle of the battles that we've seen for the last 2 years at the school level.
Yeah, I appreciate that. I guess, again, back to, do you feel like you're still going to be in the battle zone if you're following public health recommendations?
No.
So,
if
go ahead.
The health department locally or DHS or CDC provided directives to the public schools, then we would follow what they've directed us to do. Yeah. The same way that state agencies have directed us to do things from either DOJ. I mean, it's interesting. A few weeks ago, we had a situation where we attempted to do searches at Wauwatosa West. Well, the State Department of Justice has stated that we are unable to do random searches. We can do random consent searches, but we can't do random searches. So when the state mandates to us what we can and cannot do, we follow the mandates. And so while it was hard to explain to a lot of families why we had to provide consent, and technically students had the ability to deny us access to the search, we were able to say we were following the directive.
Yeah. Maybe it's semantics, but for me, the word mandate is going to cause a legal threshold that I don't think our state and local health department has the authority, and certainly CDC does not have the authority to mandate to the school district level. A directive, yeah, I mean, that's, could be considered an advisory notice or, something stronger than a guideline, but it gives you an actionable way forward, but again, it's not a legally binding with an enforcement component mandate.
What language would you, so I understand that you're making a great point. So, because words are important, instead of mandate, what would you just take out mandate and just say directives?
Well, I mean, I leave that to Laura and how she would frame it. And if directive is enough of a gray legal language, then that's fine. But if it's really a guideline or a recommendation, then that may be where she would want to weigh in.
Yeah, I think keeping the first section where it says you'd follow mandates is important, because hopefully you would follow any mandates that do come out. But like Ann said, it's harder and harder to have those at the local level and even state and federal level. So, I think most of our local information will come through the form of recommendations and guidelines. We could talk specifically if you need something stronger than that to make changes. I think the wording leaves it open enough that there are options. I think, even when we look at those, number one, it could be including, but maybe not limited to these things, leaving it open for potential changes.
I like that.
I struggle a little bit with saying masks will always be optional, because if we do get to a CDC level of high, masks would be recommended. It's hard to anticipate where we're going. It seems like we're going in a good direction with COVID, but we are starting to see that, increase in cases and positivity rates. So we're definitely not done. Cases have been mild, which is great. I hate to just put a strong stop on that, not knowing what the future looks like.
So Laura, would you recommend that? So, yeah, I guess I need direction then in terms of, if it's not mandated, would it be mandated directives and or guidelines?
Yeah, I guess it's, what are your intentions with following what we're telling you? If it needs to be a directive for you to take that and implement it within the school, we can use the word directive, and we could, include that language. If you'll follow recommendations and guidelines like we've been providing more recently, that would be sufficient. But if our recommendations are kids should wear masks, it sounds like your intention isn't to implement that.
Well, I think it will be harder for us to justify it or to mandate it in the schools solely. I think that's where we've struggled as public school institutions, not only in the metro area, but nationally. The argument that other people have made is the school district has unilaterally placed themselves into public health spaces. If you are being mandated or you're being directed to be in that space, that's a very different perspective.
Yeah,
so I'll go back to the search component. Ideally, I would have preferred to have randomly searched the students.
Mm-hmm.
I would have preferred to have randomly searched the students. But the Department of Justice said you can only do that if the students give you consent. So the guardrails were constructed by another agency as it pertains to the law, because our sole job is to educate children. And so when we start blending and moving into the area of becoming public health officials, that becomes more difficult for us. And then it becomes debatable, right? It becomes something that it is debatable. And so I would prefer to pull us out of being part of a debatable issue of values and focusing on what we are told to do in an area that we're not experts in, which is public health.
Yeah, maybe it can offer something as a middle ground. So there are community level recommendations. CDC has those out now. They're at a county level. A directive, and it goes back to kind of public health response before the pandemic. If there's an outbreak in the school, there is consultation with the health department about a way forward to mitigate that outbreak. It's very localized to the classroom, to the school, whatever the case is. Maybe for directive, it's in response to a specific outbreak situation, and Laura and the public health department is giving you a directive to mitigate that specific outbreak. So it's much more localized. Whereas recommendation would be something that comes from a community level in our metrics, and then the district can decide, do they feel that that is impacting their learning environment with potential for outbreak, or will they just know that at a community level, that's where we are with our recommendation? So again, a directive being a little bit more based in the public health authority under Chapter 252 for the local health department to do what can and is necessary to control disease. Laura, what does that feel like?
Yeah, I think that makes sense. That feels, it feels sufficient from the public health side, and it
Right.
feels like it meets the needs of the school district as well.
Right.
I agree. I don't know, Caitlin, what do you think?
That's sorry, that's fine. I mean, if it's already written in state statutes, I don't know that we need to be redundant in the administrative guidelines, but
I agree, yeah.
because this isn't actually the policy. It's my understanding our policy already exists. This is just how we're going to act out the policy. So this is just, and we can change this 10 times a year if we want.
Oh, it's
just
not legally binding.
Yeah, so it's just saying how we're going to act out the policy. The policy already exists that says we have to follow what the health department and DHS and CDC says. This just says how we're going to do that.
So is this even needed? I mean, aren't they sort of redundant?
Generally in schools, you have both. Usually the policy is very short and sweet, and it really reflects Wisconsin state statute. And then the administrative guidelines just says how that applies to our district, or it's got a little bit more in depth. Like our medication administrative guidelines is like 3 pages long, versus our medication policy is much shorter.
And I think in response to some of the families who appropriately ask, so what are you going to do when there's an outbreak? What's your plan? How do you move forward? We didn't have a response initially after the board made their decision and gave the authority back to administration. This allows the public to know how will we respond, and it's in writing. It's not hearsay or just directing people to policy.
I guess one final point, I would still remove the word mandate on there because that's a legal term from public health authority. So, again, in a local outbreak, it's still going to be Laura providing direction to you, directives, but again, it's not going to be under an order from the health department.
That it has been, I'm going to just take that out and go directives. Okay.
I learned something brand new because I had no idea what the difference between a mandate and a directive is. So always good to learn something new. That was good.
That is good. Laura, I want to make sure you're feeling comfortable with this.
Yeah, I think it looks good. Like I said, I think the wording leaves, some flexibility for what the rest of this year looks like, what next year could potentially look like.
Okay.
I don't know. This kind of is captured in number 1, but making sure that families have the information that they need to follow recommendations, or, if the school has an opportunity to share what those recommendations are with families, that might be worth including.
Help kind of flesh that out a little bit more, Laura.
Yeah, so you have, maximize health and safety of students through mitigation practices. A lot of that requires education for students and families about what that actually means in the school. So, and maybe that's sort of inherent in that, but if recommendations change and you are wanting to pass that along to students to make sure that they're safe in the school, does that need to be included in this guideline?
Something to that effect?
Yeah, that sounds good.
Because we should, right? I mean, if we really want to keep not just COVID-19, but just all illnesses, if we're really committed to it, then we should commit to this. And I can work with Sarah Fatita we have a good campaign packaged right now. It would be now a matter of just refreshing it annually. It's a good suggestion. Thank you. Any other suggestions or comments?
I think I was just going to respond to the comment about sort of this question of what to tell families when things might change and everything. And I think there just has to be a lot of expectation setting on this, because I think, as we've talked about, COVID's not necessarily going to go away, but I think it will continue to evolve. And it may evolve in ways that we can't predict. So I think, on one hand, it could unfortunately evolve to become more serious, and, whatever standards we have now would maybe change downward. And hopefully the opposite is true, where, this continues to be something that we eventually find a way to kind of live with, and it perhaps becomes more mild. And so the numbers that were an issue, last year may not be the same thresholds we would use in a year. So I think that the hard part is we may not be able to give us a certain threshold, but sort of setting those expectations that it, may vary depending on, to be honest, what the virus does, what the variants do. And that goes, I think, to your point of there may be times where we need to reconvene, depending on just where the future takes us.
Just to kind of riff off that a little bit too, I think that's, say what you will about kind of what the CDC has done and how they've approached it and how they've changed their levels. But I mean, one of the ways in which they've evolved is with this community level, right? Is where the focus has become more one of disease severity overall, because that seems to be maybe where the more of the issue is at least currently the disease being a little bit more mild overall than it had been, say, 2 years ago. So yeah, for what that's worth.
Yeah, I agree. Okay. Well, thank you for the feedback. AJ, you definitely win the best background of the day, most appropriate on May 4th. So thank you so much. And this is if there's no other feedback on the guidelines, what I would say is I've always been apprehensive about trying to find a time to recess. Now we'll use the word recess our panel, because I really appreciate you and don't want to give the impression that I want to shut this down. I don't. But I don't I don't see us at a point where it's prudent, a prudent use of your time to continue to meet for the sake of meeting. And so it's my suggestion that we caucus until there is a need. Again, I'm trying to use language that doesn't mean that we are disbanding, but we're on a break. So we're Ross and Rachel right now, and we're just on a break. And
You beat me to that. I was just going to chime in with that thought.
and so if you're all comfortable with us just being in that space, but understanding that we don't know where this thing will go. And if anything we've learned over the last 2 years, we have to be flexible and nimble. And I would be honored if we need to reconvene, that you all would be willing and able to come back.
Sounds good to me.
Laura doesn't have a choice.
Laura does not have a choice. She's stuck with us. Yes. But we appreciate you. And when I talk to my other colleagues and I tell them about the amazing group of professionals that we have on this panel, they're envious. And so this is not goodbye, it's just so long for now, until an unfortunate break will happen. But the solace I have in all of this is that if we do find ourselves in a bad situation from a public health standpoint, our children in our schools have a great panel to turn to for advice. And so in many ways, I hope that we don't reconvene, because that means we're healthy. But if we do, it's a security blanket like no other, to know that you're all willing to come back and guide us through the next iteration of this journey.
That sounds great.
Yeah, sounds like a good plan.
Yeah.
Okay.
Agreed.
Thank you for the feedback. We will post this with your changes, this guideline, so people know how will we respond to any to COVID-19 internally moving forward. And I'll also send the final version to our full panel as well, with the language of we're just on hiatus until we're needed. Thank you all so much. Want to use your time wisely. So with that, I would adjourn.
All right.
Excellent.
Thank you.
Take care. Have a good night.
Thank you, everyone.